from what we projected is quite a bit higher, as we can see by the budget that we now have for expansion is two and a half times higher than what was projected. And so I think the projections on the numbers that we submitted and the projection and the costs that we are actually incurring will probably make this a lot closer to cost neutral for the federal government. You can answer the question. If you can answer better than I can, that's fine.
Mr. Chairman, I would never say that, obviously, but Representative, all I would add to that is that if this were a standalone waiver we were discussing, I think that would be an incredibly valid fear. But there's 10 other provisions in this that will save the federal government money. When Arkansas implemented its work requirement for a time, it saved the federal government money because those folks exceeded the federal poverty level, got into private healthcare coverage, and then went up toward 400%, and then in many cases exceeded it. And obviously those subsidies taper off. And so paired with the 10 other cost-saving measures, overall this should save the federal government money.
Representative Healy.
Thank you, Mr. Chairman and Mr. Senorino. I don't know if this question is for you or Representative Redmond, but in here, I know oftentimes we like definitions. Can you define able-bodied for us? In Section A, it talks about able-bodied, and while I appreciate that, I'm not sure what able-bodied means.
Scott, I'll let you answer that one. I don't know.
Mr. Chairman, well, and certainly Representative Redmond takes priority over me if you'd like to answer that. In general, the definition is kind of, you can see it, it's sort of by negative, but in line 37 on page 1, which is where the work requirement starts, you'll see the exceptions. And the primary one there, I think that goes to your question, is the third one. If you're medically certified as physically or mentally unfit for employment, that counts you as not able-bodied. So an able-bodied person is someone between 1964 and is able to work, essentially. And there are additional definitions in federal code, especially in the food stamp program. There's a lot of definitions out there if you want more definitions, but that's the simplest one that's in this bill.
Follow up?
Yes, thank you. So just so I'm clear, it's anybody that is considered, what's the word in here that we use? Not disabled. Because I would believe that medically certified or as physically, so if they're not physically able, that would possibly be disabled.
Scott.
Mr. Chairman, Representative, great question. So in addition to folks who are disabled, obviously seniors and kids are also not considered able-bodied. But this has fewer able-bodied adults in the definition or fewer individuals in the definition than if you just go by eligibility category. So for example, a parent or caretaker, in general, you could say that that's an able-bodied person, but this provides them, because they're not in the disabled category, they haven't gotten a Social Security disability determination or anything like that. And yet, if they're not able to work, they can go to a doctor and get medically certified as not being able-bodied and get exempt from that work requirement. So this includes more people who might face barriers to work than the minimum definition.
Representative Roberts. Representative Dixon.
Thank you, Mr. Chairman, Mr. Santorino. So you've mentioned a few times that we have this package of 11 waivers that we're seeking. Can you explain the process when those waivers, how does the federal government look at it? Because my understanding is that they look at them one by one. So even if we send a package, what's your understanding of how that will work?
Scott.
Mr. Chairman, great question. So there are two kinds of waivers, and I'll spare you the details unless you really want them, but there's an 1115 waiver and a 1332 waiver. Waivers can be submitted as a package. Arizona's entire Medicaid program is in a waiver. It's done by one waiver, a global waiver. And so there can be various provisions, different moving parts to one demonstration waiver. That would probably be the approach that would make sense under this bill and not, by the way, not all 11 of the conditions require waivers. Several of them do not. But they should and can go in a single waiver.
No, Representative Wheeler.
Thank you,
Follow
Mr.
up
Chairman.
again.
New question.
Yes, new question. Okay.
Mr. Santorino, I need a little help on the improper payment rate. conversation, which I think we're down on line 26 of page 2. This is kind of a logistics question, but we've got a section in there that talks about that improper payment rate is got to be confirmed by a biennial majority vote of both the Senate and the House of Representatives. What happens if the Senate is wrong again and disagrees with the House? You know, what is that going to be like a rules thing again? Is that, you know, walk me through what that looks like and
Might
what
be a conference committee. Yeah, Scott.
Mr. Chairman, I think that might be the most loaded question I've ever received. I don't know enough about the legislative procedures in this building to know exactly how that would work. I trust you all to do that. I think that the goal here was to give you all a little bit of flexibility in assessing how the department is doing, rather than just having an automatic, here's the most recent federal report, it says the improper payment rate is 7%. Bam, you all get to look at the numbers, you get to question the department, see what's going on, not just rely on one source. And so if there's a disagreement between the two chambers, I would assume that that's a substantive disagreement and that one chamber didn't think the improper payment rate was below that threshold.
Follow, Mr.
Follow-up?
Chairman. Thank you, Mr. Senator. I think that gives me that answer. But help me with the improper payment rate definition. I mean, you provided us with the spreadsheet, which is always helpful. But is this the federally defined improper payment rate, or is it? I think PERM is the other thing that we could consider improper payment rate. Tell me how that number works.
Scott.
Mr. Chairman, great question. So it is it's a federal term. You don't need to make it up for yourself anew here. I don't have the language in front of me, but I can tell you what it generally represents. The most common mistake made in looking at what that means is people assume that it's a fraud rate, that's only people who are scamming the system, nursing homes who are saying that they're providing benefits to folks who have died 6 months ago, and they do so knowingly. Fraud is a separate criminal, that has a separate criminal definition. Improper payment rate is a bigger issue. It's a bigger number, it's a bigger problem. Improper payment rate, the vast majority of them, over 90% of improper payments are caused by eligibility errors, not fraud. And so what does that mean? It essentially means any dollar that goes out the door that goes to someone who should not have received it under federal law, or goes on behalf of someone who was not eligible under federal law. And so imagine somebody who passed away 3 months ago and a payment goes out the door to that nursing home. It might be that the nursing home did not commit fraud, but that's still an improper payment, because obviously dead people should not be eligible for Medicaid and payments should not be going out on their behalf. If someone's income goes up and makes them ineligible for Medicaid, and yet a payment goes out the door, that would be an improper payment as well if it's made on behalf of an ineligible person.
Not seeing any more questions. Thank you, Scott, for your time. We
Thank you, Mr.
do
Chairman.
have a list of people who would like to testify. I have several pages here, and we will follow that at this point. So what I would like to do is call 3 people in line so that if people are lined up and ready to go. And the first one will be Bonnie Schuster. The second, which is virtual, will be Scott Dunn. And the third will be Hillary Hagan, which is in person. So please identify yourself, who you represent. The time is yours, and please try to keep it to 2 minutes. There will be a timer somewhere. I thought you had a timer.
I got the timer here. They're not up on the screen.
It's not up on the screen.
He's supposed to be able to put it on the screen.
Yeah, I clicked on it. It says not pulling up.
Okay, do you have a clock? Your phone?
I do, but I'm not going to keep
Timer, I
track.
can tell you.
Okay.
Okay, but we'd like the person. Okay, so he has a timer on his computer. We're supposed to have it on the screen. So
Only team. I'll be right back.
if not, I will give you a signal at 10 seconds left.
Okay.
I'll watch his timer on there. So, and it'll start once after you identify yourself and who you represent. So
Okay.
time is yours.
Thank you. Mr. Chairman and committee members, thank you for the opportunity to testify today. My name is Bonnie Schuster. I live in Boise. I represent myself and I oppose House Bill 419. My husband and I were and are staunch supporters of expanding Medicaid to help those in the gap obtain health insurance coverage, and we were among the overwhelming majority of Idaho voters who voted in favor of it. My understanding is even a larger percentage of Idahoans support Medicaid expansion today. We didn't vote for and we don't want draconian conditions that restrict eligibility and, far worse, trigger a complete repeal of Medicaid expansion because all of the conditions cannot possibly be met. You don't solve the issue of high healthcare costs by taking away people's healthcare coverage. You don't support workforce participation and productive citizenship by taking away people's healthcare coverage. You don't help lower income Idahoans make ends meet by taking away their healthcare coverage. I worked for 32 years for the section of the U.S. Justice Department that oversees bankruptcy cases. I saw firsthand over and over the financial ruin that people without healthcare coverage face. It only takes one serious illness, one short hospitalization, one childbirth to create crushing debt for a lower income uninsured family, a family where one, if not both parents, are almost always working. Why would you want to take away health care coverage from our lower income adults? I implore you to vote no on HB 419. Thank you.
Thank you. Any questions for Ms. Schuster? Not seeing any. Thank you for your time. I did have Scott done, but that's, he's,
Thank you for
do
your
you,
time.
do you have, is he up
Yes.
online or not? You want to pull him up? So in the meantime, for the sake of efficiency, Hillary Hagan and Scott will come up after that, and then Carol Augustus will be following. So please state your name, who you represent, and time is yours.
Thank you, Mr. Chairman and members of the committee. My name is Hillary Hagan, and I represent Idaho Voices for Children. We are opposed to House Bill 419. This legislation states, specifically in the fiscal note and also on page 1, lines 10 through 19, that all conditions outlined must be met by July 1st, 2025, or Medicaid expansion is repealed. Several of the conditions will require the state to prepare, submit, gain federal approval of complicated waivers, and then operationalize within a very strict timeline. I do have a handout for committee members that goes through all of the conditions outlined in the bill and the type of waivers that would have to be submitted. Thank you. So I would like to focus in on 3 very specific conditions in this bill, specifically because they have been rejected before and attempted by other states. So in particular, of course, the Medicaid choice, or the advanced premium tax credit on Idaho's health insurance exchange, was attempted as a part of that Senate Bill 1204 in 2019, and it was rejected because it didn't meet that cost neutrality requirement. The enrollment cap was attempted by Utah during the Trump administration, and it was rejected. And the lifetime benefit limit was attempted by Arizona, and it was rejected. I have more details in that sheet. I know given time, I won't go into the details. Particularly about the work requirement, I do want to mention. This has been attempted in several other states. Georgia does have one implemented. They have been approved during the Trump administration, but they all ended up in litigation, and then it was blocked from being implemented because it violated that central tenet of Medicaid law. So essentially, 419 will result in Medicaid expansion being repealed. And so I ask that you vote no, and I'm happy to answer any questions.
Any? Representative Blanksma.
Just for a comment, Mr. Chairman, for everybody, for the presenters that are coming afterwards, this is a 8-page document, and so what you're asking us to do is ignore other presenters and read it, if it's coming to us at this time. So I just, note to self, it's much better to have this kind of documentation available to us before the committee meeting.
All right. Representative Rubel.
Thank you, Mr. Chairman, and thank you, Ms. Hagan. It was represented by the previous presenter that Arkansas's work requirements had been very successful until they were blocked by a court. I don't remember the details on it, but I don't know if you have them at hand. Could you articulate if you know what happened in Arkansas? Did it save the money? Who was removed? What was the fallout in Arkansas?
Ms. Hagan.
Mr. Chairman and Representative Rubel. So in Arkansas, after a work requirement was implemented, there were 18,000 people that lost coverage. And research found that the majority of them were working. The problem was the administrative hurdles that were in place that made it challenging to make it through the system, and many of them were never able to actually gain health coverage again. Additionally, Arkansas spent approximately $24 million to implement and administer the work requirement.
Representative Dixon.
Thank you, Mr. Chairman. Ms. Hagan, I'm wondering, you mentioned that Georgia does have a work requirement, and I'm wondering if you could just share with us some of those details, how it works or doesn't work, or...
Ms. Hagan.
Mr. Chairman and Representative Dixon, thanks for that question. So Georgia is very different than Idaho in that when Georgia submitted their application to implement a work requirement as a condition of eligibility, so they were not an expansion state prior to submitting that work requirement and that waiver to CMS. Essentially what they said is we want to expand health coverage in Medicaid to adults up to 100% of the federal poverty line as a condition with co-pays, premiums, and a work requirement attached to it. That was approved by the federal government. The Biden administration withdrew that approval. That went through a court system, and the courts essentially said, because you are expanding to a new population, this doesn't actually violate the laws of the 1115 waivers, which explicitly state they need to expand coverage, provide access to a new population. So because the Georgia requirement was, it actually added people into a new benefit, they allowed it to stand, and that's why Georgia was able to move forward with it, because they were a non-expansion state when they submitted that. Because Idaho is an expansion state and we would be adding this on after the fact, it essentially would ask the state to add restrictions on expansion, which essentially have been shown to reduce access to coverage. So that's why Idaho and Georgia are very different.
Thank you. Not seeing any others. We now have Scott Dunn online, so we'll start with him, and then Carol Augustus, and then David Lehman. So.
Good morning.
Morning.
Good morning. Dr. Scott Dunn, Family Medicine in Sandpoint, Idaho. I represent myself, but also my patients. I'm sitting here getting ready to start my day in a small business. There's 170,000 small businesses in Idaho, representing about 97% of all small businesses, 56% of all employees, and about 26% of all economic activity in the state come from small businesses. But only about half of small businesses provide healthcare insurance. And so the other half are like my patient, 62-year-old guy, who's a small engine mechanic. He fixed my lawnmower last summer, and he has 2 employees. He was uninsured until the expansion opportunity. And now, of course, his diabetes, his high blood pressure, his sleep apnea can be treated successfully, and he anticipates having enough years ahead of him to be able to work until he's 70. He's really excited about how healthy he feels now. But that would all disappear if he was one of the unlucky 42,000 that were kicked off expansion under this bill. So we have to look at the fiscal note of the bill, but we also have to look at the humanitarian note. I ask you to oppose H419 on behalf of my patients, like my 62-year-old small engine repair guy who runs his own business and hopes to work many, many years in a healthy capacity.
Committee, any questions for Dr. Dunn? Not seeing any. Thank you for your time. Next up is Carol Augustus, and then David Lehman and John Barnes is the third one up. So please state your name and who you represent. The time is yours.
Good morning, Chairman and members of the committee. I represent myself. My name is Carol Augustus, and I live in District 13. I recently retired from a job that I loved. I was an in-home healthcare worker, and I loved making a difference by caring for others in their homes. However, my employer did not offer health benefits, and because of this, I fell into the coverage gap. Thanks to passage of Medicaid expansion voted on by Idahoans, I was able to get health care. In a routine screening, I found out that I had the early stages of cancer. Medicaid allowed me to get the surgery that now makes me cancer-free and able to stand before you today. I know that legislators are concerned about the Medicaid budget, but I say that Medicaid saved my life. Please vote no on HB 419. Thank you.
Thank you. Any questions? Not seeing any. Thank you for your time.
Thank you.
And glad to hear that you had the treatment for your recovery.
Thank you so much.
Next up is David Lehman, then John Barnes and Ivy Smith. So please state your name, who you represent. The time is yours.
Good morning, Mr. Chairman and committee. My name is David Lehman. I'm here on behalf of several clients, including Cottonwood Creek Behavioral Health Hospital, the Idaho Association of Community Providers, and AARP, to name a few. I'd like to focus my testimony this morning on the important role Medicaid expansion plays in delivering behavioral health care in Idaho, but I also would be willing to stand for questions related to the direct care workforce and how Medicaid expansion really does provide a safety net for people who are providing services under Medicaid. In 2020, Idaho submitted a 1115 behavioral health transformation waiver that for the first time allowed Idaho Medicaid to pay for inpatient behavioral treatment for adults. The purpose of the waiver was to create a continuum of care for individuals with severe and persistent mental illness with the goal of improving early intervention, ensuring long-term positive health outcomes, and reducing the number of suicides in Idaho. Medicaid expansion played an important role in paying for this continuum. It's had positive effects. For example, at Cottonwood Creek last year, the hospital just under 2,400 Medicaid admits. Approximately 1,375 of those were adults who likely qualified through Medicaid expansion. The average stay for an adult in an inpatient treatment facility is 7 to 10 days, which means the adults that in some state of crisis received more than 10,000 days of treatment in an appropriate setting where they could get better, and instead of in a hospital emergency room or worse in a city or county jail. One of the most expensive healthcare visits we pay for is when someone is in crisis and they're delivered to an emergency room in the back of a police cruiser. Having inpatient facilities available for adults in crisis is the right care at the right time, in the right environment, and for the right price. Medicaid expansion ensures this access to thousands of Idahoans. In the governor's 2025 budget recommendation, he proposed funding to support the development and submission of demonstration waivers for the Medicaid expansion program. In this, the executive branch and the legislative branch are already aligned. And I believe a deliberate approach to reviewing the best practice of other states and coming up with a plan is more likely to result in waivers that can be approved by CMS versus the plan laid out in House Bill 419. And as I was sitting here, I was thinking to myself, the analogy is
if
that...
you could wrap up your...
I'm wrapping up,
Okay,
Mr. Chairman.
okay, good.
The analogy to this is that this bill asks Idaho to jump off a cliff and try and build a plane before we hit the ground. And I think the alternative is let's build the plane on the ground first and see if we can get it to fly. So with that, Mr. Chairman, I'm happy to stand for questions.
Any questions? Representative Dixon.
Thank you, Mr. Chairman, Mr. Lehman. So I'm just curious because we had a presentation from someone from out of state that helped to draft this legislation. Can you tell me how your clients were involved in drafting this legislation?
Mr. Lehman.
Mr. Chairman, Representative Dixon, we weren't asked to participate in drafting this legislation. And I think, to the extent that we can be useful in these types of conversations is that providers all over the state have a lot of recommendations for how you can improve the Medicaid system, how you can make it work better and cost less and have better outcomes. So I do think there is a role for providers to play in this process, and I think that the recommendation that's in the governor's budget, and my hope is that as the department sets out to create those waivers, that we would be consulted so that we can provide input to really make the system better, as opposed to just trying to submit a massive waiver that has a very low likelihood of succeeding.
Any other questions? Not seeing any. Thank you. Next up is John Barnes, Ivy Smith, and then Rochelle Turney. Please state your name, who you represent, and the time is yours.
Thank you, Mr. Chairman and members of the committee. My name is John Barnes, and I live in District 22, and I represent myself. I am asking that you vote no on HB 419 because I may not be here if it not for the passing of Medicaid expansion. While I've had some run-ins with the justice system, I have been living in a sober house for 2 years, and I'm helping other residents turn their lives around, just like I have. I am currently working part-time as well as going to school, and because Medicaid covers the medication I need to survive, I am able to do these things. Many of the men that live in the sober living house also utilize Medicaid for medications that literally keep them off the streets and out of the justice system. Mental health struggles are a real issue after incarceration, and Medicaid covers life-saving counseling and therapies for folks like us. Please consider people like me and what the passage of this bill would do to our friends, families, and communities. I humbly ask that you vote no on HB 419. Thank you.
Thank you. Any questions for Mr. Barnes? Not seeing any. I'm your representative in your district, so thank you for coming.
Thank you.
Next up is Ivy Smith, and then Rachel Turney, and then Fred Birnbaugh. Okay, so then Rachel Turney. Is she in the other overflow or not? We will come back to her if necessary. Fred Birnbaugh.
Good morning, Mr. Chairman. My name is Fred Birnbaum with the Idaho Freedom Foundation, and we stand in support of House Bill 419.
Surely.
As I listened to the testimony and the excellent presentation from Scott Centurino, I think there's some misunderstandings of why this bill could be very effective. If you think about the waivers that have been submitted in the past, what incentive was there for CMS under any administration to approve them? The beauty of this bill is that the waivers, A, would be packaged, but B, if they were not approved, Medicaid could be repealed. So you actually have a dual incentive here. That's why this is such a good bill.
We don't want to take
Because, and actually we should use the Georgia example as an example. CMS will see this as an opportunity, as a package to save money, but they'll also understand that the way the bill is structured, if they say no to the waivers, then Medicaid, potentially, Medicaid expansion could be repealed. So I think this is a completely new and innovative approach that flips the script a bit. So to the extent that CMS in the past might have slow-rolled waivers, now this bill puts timelines in there. And I think that's very important, because the incentive to approve the waivers is there. The other thing that the waivers do as in totality is save money. And If I had more time, I could go into the details of that.
Well, I think
But
you
just
better go.
recall, everyone, when Medicaid was put in place, as the good chairman
obvious.
said, it was a $400 million program, and the governor's asked
Koch
this
brothers
year,
paid
this is
for it,
just the
right?
expansion piece, is $1.1 billion. And when Medicaid was voted in by the voters, Medicaid expansion to the able-bodied, not the traditional program, U.S.
61%.
debt was $12 trillion lower than it is today. This reform is timely and it's needed. Thank you, and I'll stand for any questions.
Trump put on 7.8
questions?
trillion.
Representative
It wasn't because of
Roberts.
Medicaid
Thank you, Mr.
expansion.
Chairman, and thank you, Mr. Birnbaum.
Oh, my goodness.
I have a question regarding that last statement about the $12 million or $12 trillion increase. Is that all attributed to the expansion of Medicaid in Idaho?
Mr. Birnbaum.
Mr. Chairman, Representative Roberts, of course it's not. The debt on November 30th, 2018, according to the monthly statement of public debt of the United States, was $21.8 trillion, and now it's $34 trillion as of December 31. But Medicaid is a component of that growth.
Oh, come on.
Medicaid, the federal outlay has tripled since Obamacare, so it's now around $600 billion. So if you add all those years that since we've expanded with Obamacare, it is an important component of the increase of the debt, but it's not the sole driver.
Well, I can tell you are a
Any
lawyer
other
because your
questions?
lips are moving.
Representative
Lying.
Gallagher.
Thank you, Mr. Chairman and Mr. Birnbaum. What would the impact be if the federal FMAP rate or federal medical assistance percentage rate for the expansion population was reduced by the federal government to mirror the rate for traditional Medicaid population?
Mr. Birnbaum.
Thank you, Mr. Chairman, Representative Gallagher. So this is an important question. One of the incentives the Obama administration provided to states to expand Medicaid was that the expansion would be funded at a 90-10. Idaho's traditional rate was circa 70-30. It's a little different now because our state incomes have increased. So if you take the delta between 90-10 and say 68-32, that's about where we're headed.
Magic
That would
statistics,
be
magic math.
a $250 million annual
No,
hit
come on.
to the general fund
I know how to do
if the
numbers
federal
too,
government
but I
were to
usually,
equalize the
I
traditional
seek truth. I
and
don't
the
seek
expansion
baloney
FMAP rates.
that you're saying.
And if you think, well, that's not a possibility, again, we do have $34 trillion in debt, and I have talked to members of our
During the Trump
congressional
administration,
delegation,
7.8
and that is on the
trillion.
table. The
Tax
U.S.
breaks
Congress
for
is
the,
looking at how do we reduce the growth
CEOs
entitlement spending,
was $3
and that's a
trillion of
very obvious one, would be to equalize the match rates between
No.
traditional Medicaid and the expansion. That would be a
Sorry, buddy.
$250 million
Yeah, your
annual
numbers.
hit
Oh, that's a
to the
great
budget.
numbers. Where do you get them? You got them from Alec, eh?
Follow up.
For a follow-up, Mr. Chairman and Mr. Birnbaum, just a simple, super simple question. Are people going to lose coverage if they work?
Mr. Birnbaum.
Simple answer is no, but one of the reasons this confuses people, yes, if you
we wanna
work
confuse
an
people.
hour a week, that's not. If you consider
if
that
we
work, I
confuse
would.
people, then people won't
And
know
actually,
which
Mr.
way
Santorino
to go,
spoke to
right?
this when
Just
he
like you
talked
did
about
with
18
Medicaid
hours.
expansion
He
when you
simply
blocked it
took
for
the
6 years.
federal poverty limit. It's about
Turned down over
15,000
$400 million.
roughly, right? And if you divide that by 1,000 hours, you get 15 an hour. So if you did the math, roughly 20 hours a week.
Nothing you say.
So, and that just gets
is believable,
you to
sir.
100. Obviously, one of the things that people are forgetting is that we have more job openings in Idaho than job seekers.
Now we got to shift the jobs.
So there's work
Okay.
available,
Yeah,
and
so
that's
what does
one of
that
the
mean?
reasons that people are paying
Right
way
now,
over the minimum
unemployment's
wage.
3.6%.
And to the extent
Plenty
you
of
avail
jobs
yourself as an
at
able-bodied person to that work,
$7.25 or $11
you can
an hour.
purchase
Which
insurance
won't
on
raise
the
the
exchange.
minimum wage.
Any other questions? Not seeing any. Thank you, Mr. Birnbaum.
Thank you, Mr. Chairman.
Goodbye. Don't let
Okay,
the door hit
next
you on
up,
the way
and
out.
I've been reading my chart wrong. So next up is Jennifer Johnson, and then Brittany Shipley, and then Beth Markley. So please identify yourself and who you represent, and the time is yours.
Thank you, Mr. Chairman and committee. My name is Jennifer Johnson. I represent myself, and I am from Boise. I'm also a local small business owner and a single parent to twin boys, both of whom have serious medical conditions. The small business that I run helps to provide children with disabilities with access to specialized equipment and also welcomes children of all abilities, making it a safe, inclusive space. I opened my business because I have children with disabilities and I saw the need. But like many small business owners, I'm not rich. My children and I are a part of Medicaid Expansion and rely on Medicaid Expansion to access the routine medical care and prescription medication we need. Medicaid Expansion allows me the opportunity to work, to provide a service to the community, and to continue to contribute to Idaho's economy. Without Medicaid Expansion, I would not qualify to get health coverage through the exchange with a tax subsidy, and therefore I would have to decide between purchasing expensive health insurance and with a high deductible and co-pays, or go without health insurance to pay for food and housing and hope that I do not get a major illness which could lead to my death. I know the real cost and dilemma because prior to opening my business and prior to Medicaid Expansion, I found myself unemployed and between jobs for several months. During that time, I received unemployment benefits, which put me in the gap. I made too much for regular Medicaid, but not enough to qualify for a subsidy. If this bill passes, when one of the many provisions is not met, Medicaid Expansion goes away, and I'm left back in that same gap, unable to afford high insurance premiums and deductibles. I did some quick research on the cost of health insurance on the exchange without a subsidy, and I could pay a premium of $687 and have a deductible of $17,800, which would include $50 copays and $20 for each prescription. I could get a $2,000 deductible if I paid $1,117 in monthly premiums. These are premiums I could never afford. I urge you not to move this bill forward. Please help people like me keep the coverage we rely on to ensure we can work, run small businesses without having to choose between food, housing, or medical. Thank you.
Any questions for Ms. Johnson? I have a quick question. You are working, so if the work requirement wouldn't affect you in this, if that work requirement is there, this wouldn't affect your eligibility. That's correct, because you are working, right?
Right, but if any of these provisions, the Medicaid Expansion goes away, and then I'm back in that same gap.
Thank you.
Bravo, very good.
Next up is
Don't let him get
Brittany
away with
Shipley, and then the third one up is Abby Davids.
That's just written.
Oh, that's written, okay. So go ahead and take the time. I'll get organized here. Just state your name and who you represent, and your time is yours.
Okay. Brittany Shipley, and I'm representing myself, and I oppose House Bill 419. Chairman and members of the committee, as a social worker and the former executive director of a mental health organization, I have seen firsthand the positive transformations in the lives of Idahoans as a direct result of the Medicaid expansion. As the parent of a child with complex co-occurring behavioral health and developmental disabilities, I am deeply concerned about the potential consequences of House Bill 419. My son, despite his able-bodied appearance, falls under the criteria listed in the bill as an able-bodied Medicaid enrollee. My son is a wonderful human with interests in animals, football stats, and video games, who lives with complex co-occurring behavioral health conditions meeting the criteria of a serious and persistent mental illness and developmental disabilities, leaving him with the functional living skills of that of an elementary-aged child. My son has spent more time institutionalized in psychiatric residential treatment facilities than in his home and community over the past 4 years, due to the safety concerns for himself and others. He has experienced significant challenges that have resulted in incarceration. The proposed bill's stringent parameters and enrollment caps pose a significant risk of placing individuals like my son on waiting lists. Despite the invisible nature of their disabilities, individuals like my son juggle the demands of mental health, invisible disabilities, and societal judgments while striving to maintain employment and stability. By limiting Medicaid enrollment and imposing strict criteria, we risk institutionalizing and incarcerating vulnerable individuals, resulting in higher financial and societal costs. Idaho is on track to become the sole state in the nation legally imprisoning dangerously mentally ill patients due to a lack of secure treatment options. Passing House Bill 419 will seal the fate for many Idahoans with serious and persistent mental illness, including my son. As my son approaches the age of 18, he has a promising life ahead filled with potential contributions to our community. I implore you not to foreclose on his future and the futures of countless others by passing House Bill 419. The institutionalization and incarceration of those with serious and persistent mental illness are not only financially burdensome, but also fundamentally detrimental to the well-being of our state. I appreciate your time and consideration, and I will stand for any questions you may have.
Thank you. Any questions? Not seeing any, and thank you for talking as fast as you could. I could tell that was going fast. Yeah, yeah. So we appreciate people trying to keep it within the time frame. So, am I on the right page now? Okay, so Michael Sandvig is in person, and then Christine Curry is virtual. That's all the two I have on that sheet. So Michael will come up and.
Pardon me, but you had Beth Markley's name ahead of mine.
All right, if you'll come up, and I don't know if how did I miss that one.
Thank you, Mr. Chairman. Members of the committee, my name is Beth Markley. I am the Executive Director of NAMI Idaho. We provide support and education and advocacy for and on behalf of folks with mental illness and their families. I'm testifying in opposition to this bill, both as a representative of NAMI and as a parent of a young adult with serious mental illness. Of the Idahoans enrolled in Medicaid Expansion, 1 in 4 has a primary diagnosis of serious mental illness, which could be a psychotic disorder, bipolar disorder, major depression with psychotic symptoms, or treatment-resistant depression. The Medicaid program covers many inpatient and outpatient mental health services like psychiatric treatment, counseling, and prescription medications. Medicaid Expansion has allowed these people and their families access to a wider range of behavioral health services so that they can get more comprehensive treatment than they would otherwise. Early diagnosis and effective treatment of mental illness improves outcomes and reduces costs, and yet the average delay from the onset of symptoms to treatment is 11 years. The expense of treatment and shortage of resources are frequently the reasons for this delay. Prior to Medicaid Expansion, our mental health system was more fragmented. Access to care was almost impossible if you couldn't afford health insurance, and often limited even if you could. For many Idahoans with a serious mental illness, Medicaid Expansion provided access to consistent treatment, and for many, it was for the first time. A year ago, my son was in a state of acute psychosis. He was diagnosed with schizophrenia. He couldn't focus enough to have a short conversation or concentrate on a television show. His condition became so acute, he didn't believe we were his parents. Under Medicaid Expansion, he receives the medication and treatment he needs to function. He's now able to hold a part-time job, he can drive a car, he can maintain his friendships, and he can think about the future. He hopes to go back to school, and he wants to be a mechanic. Medicaid Expansion, in short, saves lives like that of my son. Please vote no on this bill. I'll stand for questions. Thanks for your time.
Committee, any questions? Representative Wilson.
Thank you, Chairman. As a representative of a mental health organization, can you speak a little bit to the impact on suicide rates that the Medicaid Expansion has?
Yes, frequently suicide rates and instances of mental illness go hand in hand. So treatment for things like acute depression under Medicaid Expansion can seriously impact rates of suicide ideation and completion.
Any further questions? Seeing none, thank you.
Thank you.
Okay. Mr. Sandvig, then Christine Curry, and Dr. Jonathan Chu. Please state your name, who you represent, time is yours.
Thank you, Mr. Chairman. My name is Michael Sandvig. I live in eastern Idaho, and today I'm representing the Idaho Council on Developmental Disabilities. I am a council member. I'm also a parent and direct support provider, unpaid, to a number of people, including non-family members. The first thing I'd like to talk about was a question that we heard earlier My son has had several direct support workers over the years. One supported him for almost 4 years, and he has a different one now, but she's still working as a direct support worker who her only medical coverage is Medicaid expansion. There are 18% in the direct force work that are covered by Medicaid expansion. There's 17% without insurance that are all candidates for Medicaid expansion. I want to tell a story about my son's roommate. His name is Laz, short for Lazarus. He has a developmental disability. He's on SSI. He's been working hard for years. He's in his 30s, trying to get off of work, or trying to get off the programs and go to work. He's working at Albertsons. He's doing a great job. He has limited abilities to understand written documentation, forms on computers, and doing things like that if it's not buying something from Amazon or pulling up a Netflix movie. But he's adequate for doing the jobs that he does there at Albertsons, and he could even be a cashier. He's concerned, and I'm concerned that when he gets off of SSI and Medicaid, that he's going to fall in the expansion, and he could be there for many years, long past the lifetime limit that you're looking at putting at this bill. So that's one of the reasons why we oppose it, besides the direct force worker. The other thing is yesterday I had a conversation with Andrew, and he's in exactly the same boat. All right, I will stand for questions.
Okay, any questions? Seeing none, thank you for your time.
Thank you.
Next up is Christine Curry, and then Jonathan Chu and Lori Scurry. That was virtual, right? Is Jonathan Chu here right now? Well, wait, we've got him, so I think.
Hello?
Can hear you, just can't see.
Okay, there we go.
There we go. All right.
There we go.
Please identify yourself, who you represent, and the time is yours.
I'm Christine Curry. I'm 73 years old and I'm representing AARP. And I would like to talk about a personal matter with Medicaid and how it would have affected my life totally. I have spent a lot of my life just making sure that I would have enough money to take care of me in my older years, which I'm sure a lot of you have also thought about. And I have two able-bodied sons, and one of the sons in 2020, he was a student at U of I, and his wife was working, and everything was fine. They had a new baby. Life was good. Very healthy young man suddenly got sick, and it wasn't COVID. He went to the doctor and repeatedly for testing for 4 months before they diagnosed it. He had a heart infection. Now, Medicaid was paying for all this at the time, and had I had to pay for it, it would have depleted my resources. So there were choices to be made here. And it was nice that Medicaid didn't make me make those choices. And so he ended up having a heart infection, which required more intervention. And then he required open heart surgery. And he's fine after all that happened. And I am still financially, excuse me, I have to yell at my dog. Okay, sorry about that.
He just wants to chime in.
And so he is now working he's now going to school in Bozeman and is doing very well, and hopefully getting a degree that we will bring back to Idaho and work in environmental research here. The point I'm trying to make is he wouldn't have gone to the doctor if he hadn't been on Medicaid, because he wouldn't have asked his mother for money, and he would have died. There was no doubt that he was going to die from what was wrong. And if I had paid for it, I would be financially destitute. So I think that, we have to follow where this goes. You're going to pay for me in a nursing home or pay for my son having surgery. And I really think that when we're looking at Medicaid, we're pretty short-sighted when we don't follow it all the way through to see how not having Medicaid for an able-bodied person would have affected him. Thank you.
Thank you. Any questions? Seeing none, thank you for your time, and hopefully your dog is settled back in.
Yes, he's
He was
fine.
just trying to get on camera, I'm sure.
Yeah, he had something to say about Medicaid.
Yeah, I'm sure. Okay.
Thank you.
Next up is Jonathan Chu, then Lori Shuri, and the next one after that is virtual Danielle Brand Lamont. So please identify yourself and who you represent. Time is yours.
Mr. Chairman, members of the committee, my name is Dr. Jonathan Chu. I'm a retired Idaho physician representing myself, and I oppose this bill. Healthcare is a right, not a privilege. We all believe in the fundamental right to life, liberty, and the pursuit of happiness. Health, and by extension, healthcare, is part of life. A Medicaid expansion under the ACA is a step towards that goal, decreasing the number of medically uninsured across the nation. It was passed here as a ballot initiative by 61% of the voters over the objections of this body. Since then, expansion has only gained in popularity, with a recent poll showing 73% of voters now want to keep it. Thanks to the ACA and Medicaid expansion, Idaho's uninsured rate has dropped to 8.2% from 18%. HB 419 is designed to defy the wishes of ordinary Idahoans. It sets conditions of continued participation in the expansion that are nothing more than a poison pill. Under the current administration, the feds have rescinded all previous work requirement waivers issued under Section 1115. 145 Idahoans will lose coverage with the repeal of expansion. 100,000 could still lose health insurance in the unlikely event that the feds do agree to a work requirement waiver. This is basic health care, improving Idahoans' lives by managing heart disease, diabetes, and other chronic and severe diseases, including cancer, that would otherwise be unaffordable. By ignoring the will of the people, House Bill 419 will disenroll tens of thousands of Idahoans from health care, part of their unalienable right to life.
Thank you. Any questions? Not seeing any. Thank you for your time. Next up is Laura Shuri, and then Daniel Brand Lamont, virtual, and after that is Tina Hiding, also virtual. So please state your name, who you represent. Time is yours.
Chairman Vanderwood, members of the House Health and Welfare Committee, my name is Laura Scurry. I represent the Idaho Association of Community Providers. I'm a founding member going back about 25 years. I'm a multi-generational Idahoan. I'm a medium-sized business owner and the guardian of a person with a severe and persistent mental illness. I've dedicated my life as an adult to advocating for and working for people with disabilities here in Idaho, and I stand in opposition to this bill. This bill is a foreign body in our state. You all have worked so hard through the years to develop a system of care that is under construction at all times, as is your fiduciary responsibility as members of our legislature. The bill is catastrophic. There is no plane to build if this bill goes into effect. There's absolutely no reason to implement a piece of legislation that is this dramatic. There are thousands of people right now working behind the scenes in our state to develop a system of care that is the right service at the right time, for the right price, for the right severity. Will there be waste? Yes. This is government. It's how it works. It's really important to remember nothing's going to be perfect. However, Medicaid expansion in Idaho opened doors for people with disabilities and substance abuse and mental illness that's changed lives. You've heard the stories. These are real people in our state who live here. This bill is coming in from outside of Idaho. It doesn't take into account our intricacies and the fact that we do things our own way here. And I'm proud of that. And I want to continue to be proud of that. I dedicate 40 hours a week plus to developing our system of care here in Idaho. I work with legislators, I work with the state, I work with managed care contractors, and I work with clients. You have to use your common sense. This doesn't make sense. There's no airplane to build midair. There's no catch. This bill is the tank that will decimate healthcare in Idaho. I stand available for questions.
Committee, any questions? Not seeing any. Thank you for your time. Next up is Danielle Brand Lamont, By virtual? You don't have her? On my list.
May not have signed in.
Okay. How about Tina Hiding? Okay, so next up is Tina Hiding, virtual. And yeah, Ken Harris is the next one in person. And then virtual. Well, you have Tina Hiding. There you go. Okay. Please identify yourself and who you represent, and the time is yours.
Hi, I'm Tina Hilding. Hello, and I'm representing myself. Thank you for the chance to speak in opposition to House Bill 419. As you know, the effort to expand Medicaid passed overwhelmingly by voters in 2018. I became involved early on when the Medicaid expansion effort first got started. Here's a little story. As you know, Emily and her husband Garrett had a broken down old green van, and her husband and his friend had the idea of driving it around the state to try to get an initiative on the ballot to expand Medicaid for the people of Idaho. Emily thought their idea was terrible because the van basically couldn't go more than a mile or two without breaking down. She reluctantly went with them on their first signature gathering effort. But the very first door they knocked on was a grandmother who was living in a house with her grandchildren. She had cancer and was uninsured. She was struggling to figure out whether she would sell her house and her grandkids' home or get a cancer treatment, which would mean she might survive. She signed the petition, and Emily realized that she, Garrett, and Luke would in fact drive that broken down van all over Idaho. Everywhere they went, hardworking people had similar stories. They started a movement, and we gathered thousands of signatures in every corner of the state. I personally spent hours hiking hills and knocking on doors in my district to collect signatures and to encourage voting for this effort. Most importantly, the initiative passed by Idaho voters by a wide margin and is still supported widely by your constituents statewide. As Medicaid expansion got started here, I was also fighting my own health battles, including a nasty and rare cancer and a broken pelvis after radiation treatment. I am so thankful. I'm sure I'm here today because I had health insurance, as well as good doctors and loving support, which is what every Idahoan deserves. As you know, Raul Labrador once said, "Nobody dies because they don't have access to health care," unquote. I can tell you he's wrong. People do die when they don't have health insurance. I would urge you to oppose this measure and instead support what your constituents clearly said they wanted and demanded, Medicaid expansion. Thank you.
Thank you. Any questions? Not seeing any. Thank you for your time. Next up is Ken Harris in person, and then Steve Simpson and Betty Ashcroft, both of them virtual.
Mr. Chairman, I yield my testimony slot. Ken Harris.
All right. Next up then is Steve Simpson and Betty Ashcroft. They're all, next three are all virtual. They didn't show up? What about, you have Nancy Jo, okay, she's my third virtual, okay. And then after that will be Gwendola Chapman, and I think that's the only one I have on that page too. Who are you going to now? Okay, so the virtual is not showing up just yet. So Gwendola Chapman is next up. I don't know if she's in the other room yet or not. Yeah, but they signed in after this.
Oh, that's true.
Here she is. No, that's not her. Okay. Do you have William Thomas virtual? Thank you, Mr. Thomas.
Can you hear me?
We can hear you. The time is, please identify who you represent, and time is yours.
I'm Bill Thomas. I'm representing myself. I live in Valley County, District 8. This bill, HB 419, really is about ending Medicaid expansion. The restriction the bill is demanding of the federal government, as many people have spoken, will not be approved. And it will end Medicaid expansion in our state. I want to remind the legislators that 61% of their constituents voted for Medicaid expansion. In my county, in Valley County, 67% voted for Medicaid expansion. Our county commissioners, all three, bipartisan, supported Medicaid expansion because they cared about their people and they knew it would reduce taxes in the county. I was in the snow in McCall in Valley County getting signatures. Everybody I met that signed signatures, and I would say 99% of the people I saw signed signature for Medicaid expansion. They believe healthcare is a right, not a privilege. And they were speaking, not outside lobbyists who are paid by I don't know whom. Idaho Expansion Program provides health care for over 100,000 people in this state. They're vulnerable people. There are people that many of them work part-time. Many of them are not disabled, but have problems, has been addressed already. We will lose, if we lose Medicaid expansion, we will lose the federal government picking up 90% of the task of the loss. Medicaid expansion is resulting in saving to the state, the local government, and adding up to $77 million, as I understand. I urge you to vote no. Defend the people. Do not be cruel. Be kind. Thank you.
Thank you for your testimony. Any questions? Not seeing any. Thank you for your time. Next
Thank
up,
you.
Lauren Colson. And after that, Rad Nagin, virtual. So is Laura Colson in the room or in the other room? It's not Laura. Okay. How about Rad Nagin? Is that Rad? Please identify yourself and who you represent.
Mr. Chairman and members of the committee, my name is Lauren Colson. I live in District 19 and I'm a family physician practicing in Boise, Idaho. I'm also co-president and represent the Idaho Coalition for Safe Healthcare, a growing nonprofit organization focused on safe, accessible, and evidence-based healthcare, comprising nearly 600 physicians, nurses, healthcare professionals, and community members across the state. Today I'm speaking in opposition of House Bill 419. This bill would effectively repeal Medicaid expansion, which is overwhelmingly supported by Idaho voters. According to the Idaho Department of Health and Welfare, there are at least 300,000 Idahoans who are eligible for Medicaid, 145,000 of which are enrolled through Medicaid expansion. That's hundreds of thousands of Idahoans that now have access to health insurance. And at my clinic, that is an immense help in keeping our doors open. The stipulations to continue Medicaid expansion as laid out in this bill are unreasonable and unattainable. There are parts of this bill that simply can't be done by July 2025. There are other parts that are clearly discriminatory. If Medicaid expansion is repealed, those Idahoans who are on it will still need health care when they get sick. But now without insurance, our healthcare system will be forced to absorb the costs. As this affects clinics, especially like mine, who have open door policies to see everyone who walks in. Hospital care will especially suffer. If people can't get in to see a doctor because they lack insurance, they will go to the hospital. So when you have an emergency It may take you hours to get seen. If you need to get admitted to the hospital, you may spend days boarding in the emergency department because there aren't any rooms available. Meanwhile, hospitals will lose millions of dollars in charity care. Repealing Medicaid will only serve to exacerbate an already increasingly difficult situation. This would not be a rescue mission. It would be a death sentence. Emergency care will suffer, hospital care will suffer, and clinical care will suffer. Please do not forget the will of the majority of Idahoans who voted for Medicaid expansion in our state. As a physician who sees patients on Medicaid, I urge you not to pass this bill, which would harm hundreds of thousands of Idahoans. Thank you, and I will stand for questions.
Committee, any questions? Representative Wilson.
Thank you, Chair. And Dr. Colson, can you speak a little bit, as a provider, when you are seeing Medicaid patients, what sort of preventive health services are you providing, which would ultimately be a tax savings for folks? Can you tell us more about the preventive health that you perform?
Yes, thank you, Mr. Chairman, Representative Wilson. We provide a variety of screenings recommended by the United States Preventative Task Force and other professional organizations. That includes cancer screenings, that includes blood pressure screenings, diabetes screenings, high cholesterol screenings to prevent coronary artery disease. All of these things that, if not caught early, can lead to catastrophic health effects.
Any further questions? Thank you for coming in and testifying. Next up is Rad Najan, which is virtual. So the time is yours. We can see you on the screen. Appreciate that. And after that will be Jennifer Lindelin and then Michael Baker. Time is yours.
Hello, my name is Rad Wing. I know my last name is hard to pronounce, but I urge you to vote against this bill. I am one of the many Idahoans who have benefited from Medicaid, and my family and I are doing our best to run a small business. My dad is the one who's doing the mechanic work, and my mom is helping manage the financial. Because we made a little bit too much money to qualify, we had to switch insurances, and then for 1 month we were left without insurance. And I was very lucky that I was able to get through the month with my family. And it definitely concerned me because I am physically disabled, but also I am mentally disabled as well. I have ADHD and depression, and I've had suicidal thoughts before, and I'm seeking a therapist to help me with that. But for that month, we had to cut out all of our spending as much as we can. And for us, even though my dad was working maybe even 12 hours a day, each day, every day, 6 days a week at least, we definitely were struggling. Even getting on our new insurance, getting medication has been tough. And my new insurance does not approve of the ADHD medication that I've been taking, and it's been frustrating to communicate with them why I need it, even though I've been taking it for at least 2 months now, and it's been helping me a lot. I'm a college student, and there's no way that I would be able to afford a lot of the medical expenses without insurance. And so and even some of my teachers, like my dance professor, does not have insurance despite needing it and struggling with money. And the Boise State University does not provide insurance for him. And so, as you've seen with all the stories of people here, their medical insurance is very important. And even though people on the outside may look like they're able-bodied, we don't know what they're struggling with. And all my friends and peers, they all struggle with mental illness, and I cannot judge them for seeking extra help. Please oppose this bill, and that is all the time I have.
Thank you. Any questions? Seeing none, thank you for your time. Next up is Jennifer Lindelin, and then Michael Baker, and then Dr. Andrea Christopher. So is Jennifer not here? Is Michael Baker here?
Hello, my name's Michael Baker. I'm representing myself. I'm the CEO of Heritage Health up in North Idaho. We're a community health center. I'm here in opposition to HB 419. It's a bill that sparks significant conversation about the future of Medicaid in our state. In my recent meeting with Representative Jordan Redmond, the sponsor of HB 419, it was heartening to hear his assurance that he's not opposed to Medicaid. In fact, his intention is to support and fortify the Medicaid system. That's a goal that I and many others in the healthcare community share fervently. We all seek to build a Medicaid system that is robust and capable of delivering even better healthcare to Idahoans. However, while I align with the spirit of strengthening and expanding Medicaid, I must express my grave concerns regarding the technical details of HB 419 as currently written. The proposed measures are a disaster and appear to pose significant challenges in implementation. These technical flaws could inadvertently lead to reduced access and potential destabilization of the care that our current Medicaid system provides. Our collective goal is to enhance the healthcare system in a way that benefits all Idahoans. This includes ensuring that Medicaid remains a reliable source of healthcare for those who need it most. It's crucial that any reform or restructuring of Medicaid not only maintains but improves the accessibility of and quality of healthcare. To achieve this, I propose a collaborative approach where actual Idaho healthcare professionals, legislators, and community stakeholders work together to refine the technical aspects of the bill. We need a Medicaid system that's not only financially stable, but also responsive to the needs of our communities. This includes a focus on preventive care, mental health services, and comprehensive coverage that truly makes a difference in people's lives. So in conclusion, while I support the idea of strengthening Medicaid, I must express my grave concerns on the technical aspects of this bill. Thank you.
Any questions? Representative Wilson.
Thank you, Chair. And Mr. Baker, can you please speak a little bit more about the role of these community health centers in our state and who they're primarily serving and how you would be impacted if this were to happen?
Community health centers in Idaho, we take care of anybody that needs our care. We are here, whether you have insurance or not. Our goal is to improve life. We want to make sure that people have access to healthcare, that is not the barrier to living a vibrant, full life. So show up. We provide medical, dental, mental health, substance use treatment coverage. I mean, we're all across Idaho. And we've built this incredible safety net for folks that need healthcare. These are patients. So these aren't people that are just, sometimes it's sad how we talk about our Idahoans. These aren't people just scamming the system. These are people that they're your neighbors, they're your friends, they're your family members. These guys are trying their best to live a great life. And we see it every single day at a community health center. And so, with the Medicaid expansion, we geared up to take care of all of these Idahoans that, in the past had been outside of the healthcare system. We've staffed up to take care of folks. If the triggers that happen in this push the Medicaid expansion out, it decimate our healthcare system. It would not be anything pleasant. So.
Thank you. Any further questions? Not seeing any. Thank you for your time.
Thank you.
Is Jennifer Lindellens showed up at all? No. So then we have Dr. Andrea Christopher.
Yes.
And then after that will be April Frederick.
All right. Dear Mr. Chairman and committee members, my name is Dr. Andrea Christopher, and I'm a primary care physician who has the honor of serving veterans. I'm here today representing myself and my patients who come from counties as far as, Payette, Adams County, Valley County, Elmore County, Twin Falls County. I'm also a health policy researcher, and I've spent part of my career examining the impact of Medicaid on health outcomes. I'm here today to talk about the importance of protecting my patients, and especially the Idaho's veteran patient population, which is near and dear to my heart. So I'm asking you to vote no on HB 419. Prior to Medicaid expansion, Idaho had the second highest rate of uninsured veterans in the country, with nearly 18% of folks who served our country not getting access to the health care that they deserve because it would be cost prohibitive. This changed dramatically when 80% of Idaho's uninsured veterans became eligible for Medicaid as a result of the expansion. We've been able to pivot from just dealing with emergencies as they arise to focusing on promoting health. So by being able to treat a patient's high blood pressure, I can prevent their heart attack. Expansion has enabled us to become proactive instead of reactive. Perhaps most importantly, Medicaid expansion has significantly improved access to behavioral health care. It remains an absolutely devastating part of my practice that veterans have a suicide rate that is twice as high as the general population. So I'm not exaggerating when I say mental health care access is life-saving. During the bill introduction, we heard lengthy discussion of every item of this bill pitched as an innovative change to the existing Medicaid program. But let's be clear what's actually happening here. This bill introduces an impractical trigger for repeal, setting forth a list of 10 demands that, if not met by the deadline of July 1st, 2025, will result in the rollback of Medicaid expansion. For those of us who know how the 1115 waiver process works, this is tantamount to repeal of Medicaid expansion because we know these will not be approved in time. Now I'm going to take a moment to play make-believe that this bill, we magically don't repeal Medicaid expansion if this bill passes. But let's talk about the unrealistic burden of all the provisions in the bill that it puts on our state. Each one of these provisions...
wrap up your...
Will do.
All right.
Each one of these provisions would require increased cost and labor to implement. Medicaid actually has the lowest overhead of all health insurance types, with the order of pennies on the dollar compared to 30 cents for private insurance. So adding these additional costs will increase the cost of running the program. And with restricting the total number of people on Medicaid is really abhorrent because we don't have a feasible mechanism to identify sick of the sick who need Medicaid coverage. Lastly, let me speak to the real phenomenon of healthcare provider burnout in this state. The pandemic was a powerful lesson about why healthcare access saves lives, but it was also a huge burden on healthcare providers.
Again, can I remind you, we're trying to limit it. So
Okay.
we have people, I've got about 20-some pages left behind this yet, so.
Got it, Chairman. Let me finish my last sentence then. Throughout my career, I've suffered from moral injury and vicarious trauma, watching the patient that I could have treated their high blood pressure come in with a devastating stroke or heart attack. Idaho already ranks 50th in physicians per capita. We've been having healthcare providers leaving at a high rate of practice. Let's not continue this trend. In conclusion, as a primary care physician, I ask you to oppose House Bill HB 419. Thanks for your attention.
Thank you. Representative Wilson for a question.
Thank you, Chair, for your question. Dr. Christopher, so with your last statement then, do you believe that this would contribute to the current status of not having enough providers around the state? Do you think fewer residents will choose Idaho? Do you feel that it will continue to decrease the amount of providers we have?
Yes, in the last 10 years of my practice here in Idaho, I have observed the trend that we have a growing population. The healthcare workforce is facing increasing challenges, and the rates of burnout, moral injury is increasing. I had several of my colleagues that I work with, some incredible nurses, leave practice of medicine because they could not deal with the incredible trauma of watching such suffering, but also the amount of increasing workload provided through that. What we do know is that healthcare providers, when we are taking care of patients who are in really dire circumstances, and as I speak at this moment, every single hospital in town is at capacity. What we see is that when we're trying to provide emergency care, instead of being able to engage in the preventive health care, such as things like what Dr. Colson was referring to, cancer prevention, treatment of blood pressure, treatment of diabetes, that increases healthcare provider satisfaction. It increases patient reported, self-health outcomes, ability to engage in the workforce. And so all of these things really are tied, and I wanted to bring some attention towards that.
Thank you. Any further questions? Not seeing any. Thank you.
Thank you.
Next up is April Frederick. And then after that, I have Candy Littner virtual. So please identify yourself and who you represent. Time is yours.
I'm April Frederick. I live in Boise and I'm representing myself. I'm here today because I oppose House Bill 419. Please don't take away Medicaid expansion, a service Idahoans overwhelmingly approved in 2018. Looking at the restrictions this bill would impose, It would be impossible for Medicaid expansion to continue. The tiniest infraction would take away health insurance for over 100,000 Idahoans. HB 419 infers Medicaid expansion hurts our state budget, but I see that by using the matching federal contribution, it saves Idaho over $50 million a year. It also saves lives in our economy, keeping workers healthy. It's not costly, but fiscally conservative to continue Medicaid expansion. Doomed for failure in the courts, since many of these restrictions have already been struck down by the federal government in other states, let's not spend our general fund on costly legal battles. Please vote no on HB 419. Thank you.
Thank you. Any questions? Seeing none. Thank you. Next up is Katie Lutmer, virtual. Virtual, Katie? Or Candy? And then after that is Gwen McEnany. And then I have Christine Moon virtual. So
The volume in the overflow room is off. Could we have a technician help us?
I'm sorry, I can't hear you.
what was the issue?
The volume in the overflow.
I can't hear you. I couldn't hear you. Sorry.
We'll take care of it.
Yep.
My name is Candy Lutmer, and I am from Jerome, Idaho. I'm a lead volunteer with the American Cancer Society Cancer Action Network, and today I'm here to oppose House Bill 419. They say that life is priceless, but I beg to differ. It comes at a cost. Cancer is expensive, and so is private insurance. But if we continue to say life is priceless, our actions need to start reflecting that. As a cancer survivor, I know too well the cost of cancer. Imagine working for the state of Idaho with great insurance and going to get your newly prescribed oral chemo and being told that you owe $10,180 because your state insurance doesn't cover the cost of oral chemo. How are you to pay those costs at that monthly prescription? So you quit your job and you go get a new one that happens to be the same insurance company, but out of Oregon, and it's covered with a $40 copay. Put yourself in this cancer patient's shoes, because that was me. Access to quality and affordable health care impacts all of us on all levels. Not only am I a healthier person because I have the health care that I need and I don't have to delay any treatment, but I'm able to contribute to society. When diagnosed with any chronic illness, the focus should be on treatment and quality of life, not red tape and bureaucracy. I can stand before you today only because I got the treatment that I needed. Medicaid expansion enables the state of Idaho to have healthier peers, constituents, and family members. It empowers people to access to preventative care. They follow their doctor's recommendations, and it causes them to take their medications as prescribed, as they normally probably wouldn't. Those are just a few things. All of these actions have been proven to cause patients to utilize emergency services less, which saves everybody from employers to the state money. Protect the health of Idaho. I ask you to protect Medicaid expansion and vote no on HB 419.
Committee, any questions? Seeing none, thank you for your testimony.
Thank you.
Next up is Gwen McEnany. And after that, I have Christine Moon, which is virtual, and Amala Shurik in person. So please state your name, who you represent, and time is yours.
Good morning, Chairman and members of the committee. My name is Gwen McElhenney, and I am a lifelong resident of Boise. I'm representing myself and my husband, Robert McAndrew, today, and both of us adamantly oppose House Bill 419 because it would, in effect, repeal the Medicaid expansion we worked so hard to secure. Let me explain our concerns. For over a decade, we attended multiple community presentations describing the healthcare crisis in Idaho and how to remedy it. Democratic representative at the time, Muffy Davis, said, "Thousands of Idahoans, our friends, our neighbors, our families, live in the healthcare coverage gap. They live in daily fear that they're just one illness away from financial ruin." We were disappointed when state leaders repeatedly refused to address the fiscal and humanitarian issues associated with the lack of affordable medical coverage. When Reclaim Idaho offered us a way to take action, we got involved. We collected signatures and educated others about the opportunity to close the gap at the ballot box, then voted for this initiative, which passed with overwhelming bipartisan support. And as a proud Democrat in this state, I have to tell you that those 61% of Idahoans were primarily Republicans in Idaho who voted in favor of Medicaid expansion. We cheered when this legislation was signed into law and then called on lawmakers to activate Medicaid expansion without making any changes or adding restrictions, believing Republican Senator Fred Martin when he said no sideboards were necessary because this legislation was perfect as written. The individuals we know who are covered by Medicaid expansion are resolving previously untreated physical and mental health challenges. The proposed changes HB 419 would be detrimental to their continued recovery. We reject the notion that Idaho voters made a mistake in passing Medicaid expansion. The legislature should cease and desist its counterproductive attempts to subvert the will of the people of the state. Thank you.
Thank you. Any questions? Not seeing any. Thank you for your time. Next up is Christine Moon, virtual. And just members in the audience, if it looks like I'm not paying attention, it's because I'm keep trying to follow all these sheets. And you don't have a Christine Moon on yours? Amelia Shirky?
Mr. Chairman and members of the committee, my name is Amelia Shirky, and I'm a family medicine physician in Boise, and I'm speaking in opposition to HB 419. The vast majority of the patients under my care utilize Medicaid to access health care. I spend my days taking care of patients of all different ages, children coming in for well child checkups, women seeking care for prenatal visits and postpartum care, visits about mental health, people living with addiction. My spectrum is broad. My patients face immense barriers to accessing health care. Many do not speak English. Many are refugees arriving to the United States with a lot of past trauma. Many do not own a car or have access to childcare to be able to leave their families to come into clinic. Many are local Idahoans who are caught in the spiral of substance use disorder. Oftentimes, just arriving to my clinic on time to an appointment is a huge win for them. The repeal of Medicaid expansion that this bill puts forth would directly harm my patients by adding more barriers for them to access healthcare in a system where they are already some of the most vulnerable individuals. Specifically, I am referring to the barriers of adding a work requirement and limiting the lifetime benefit of Medicaid eligibility to 36 months. That is not the Idaho I am proud to serve. As a family medicine physician caring for some of the most vulnerable patients in our community, I expect better from my state. Thank you for your time.
Committee, any questions? Not seeing any. Thank you. Next up is Randy Johnson, then Karen Lansing, and Zena Hartog. Please state your name, who you represent. The time is yours.
Thank you, Mr. Chairman, members of the committee. My name is Randy Johnson with the American Cancer Society Cancer Action Network. ACS CAN is opposed to this bill in any attempt to strip Medicaid coverage away from tens of thousands of Idahoans who depend on Medicaid expansion to have regular access to preventative care and checkups, services that give access to cancer screenings that result in earlier diagnoses, better treatment options for cancer and other life-threatening diseases and chronic conditions. Excuse me. I also want to thank Carol, who was up here earlier testifying, who shared her cancer story. I want to share with the committee to take a look afterwards. I have a copy for each one of you. It's a storybook that the American Cancer Society, in partnership with Idaho Voices for Children, put together that has not only Carol's story, but other stories as well as how Medicaid expansion has helped those individuals from around the state. And frankly, our volunteers and advocates from around the state are terrified of losing their coverage on Medicaid expansion. They are terrified to come of the first come, first serve enrollment camp of 50,000. For those who are left out, we know their healthcare needs don't go away. They just get shift back on costs onto the patients, onto the state and individual localities. Preventable health conditions left untreated will turn into emergencies that will lead to worse health outcomes for Idahoans and other uncompensated costs for our healthcare system. They're confused by unnecessary red tape for work requirement. In Idaho, we value hard work as evidenced by our low 3.3 unemployment rate. Work requirements inevitably make life harder for sick people who are already working 1, 2, and sometimes 3 jobs, and now they are sick and they can't work. The last thing a cancer patient needs is additional layers of bureaucracy to keep coverage they depend on for treatment. Where you live and how much you make should not determine whether you live. All Idahoans need barrier-free access to healthcare services like cancer screening and treatment. They depend on you to protect their health of them and their families. I respectfully ask you to vote no on HB 419.
Committee, any questions? Representative Wilson.
Thank you, Chairman. And Mr. Johnson, we have heard many stories about folks surviving cancer or other diseases because they were able to access care earlier. Do you have Idaho-specific numbers on how many of those stories are out there, or how many cases of cancer were caught earlier and were able to be treated successfully because of this?
Mr. Johnson.
Thank you, Mr. Chairman. Representative, great question. I don't have those exact numbers, but what the numbers I do have are we know that about over 11,000 Idahoans are going to hear those words, "You have cancer," for the first time this year alone. Over 100,000 people in Idaho are already living with cancer diagnoses. And so making sure that they get treatment is extremely important. And we know, and I can share science, I can follow up with all of you, but if preventable screenings are preventable, to have screenings to have cancer diagnosis caught earlier, like catching breast cancer at stage 1, we know is higher livability rates, quality of life, than catching it if they don't have access to screening and then they're caught with stage 4.
Thank you.
Appreciate the time. Thank you.
Thank you. Next up is Karen Lansing, and then Zena Hartog, and after that is Rebecca Takioka, virtual.
Thank you, Mr. Chairman, members of the committee. My name is Karen Lansing. I speak only on behalf of myself in opposition to this bill because I think it will precipitate the complete repeal of Medicaid expansion. And I don't think the coercion of holding a pistol to the head of federal authorities to get them to approve objectionable waivers will make them more amenable to those waivers. If enacted, it will cause a lot of harm beyond simply the people who will find their health care torn away from them. It will harm Idaho employers who will see more time lost to sick leave because their employees can't get treatment. It will harm Idaho hospitals, particularly the small rural hospitals, because they will be called upon to provide more uncompensated care. It will harm the Idaho economy because there will be more bankruptcies precipitated by medical bills, and because there are now people working who are capable of working because their maladies are managed by medical care, and when that medical care is taken away, they will become unemployable. It will also, we already have the worst physician shortage of any state in the country, and I believe the repeal of Medicaid will cause more physicians to leave the state. And this bill will harm Idaho taxpayers, according to an analysis reported last year by the Department of Health and Welfare, and also a separate analysis by an outside group. Medicaid expansion has actually saved Idaho money because it has replaced other more expensive programs for health care, including care for incarcerated prisoners, for our behavioral health centers, and for the medically indigent fund. all of which I guess were paid mostly without the kick-in of 90% federal contribution, which is provided for Medicaid expansion. So I see this as a lose-lose-lose bill. And I don't find any...
If you could wrap up, I'd appreciate it.
Yes, I was just going to say, I just
Okay.
don't find any winners in this bill. Thank you very much.
Thank you. Any questions? Not seeing any. Thank you. Next up is Zena Hartog. And then after that is Rebecca. I won't try to mispronounce that one more time. Take code. Hey. Is Tina not here? There she is. There, okay. That's Rebecca.
They shut the door. They called my name, and I'm after this person.
So this one not show up. Okay. Please state your name and who you represent, and the time is yours.
Hi, I'm Becca Tadioka. I'm representing myself, and I live in Legislative District 27. I am guardian to my older sister, Mary. In 1989, she had a head-on collision, and as a result, she has been a Medicaid recipient in Idaho for the majority of her adult life. Since the Medicaid expansion happened, the difference in Mary's health care is notable. For example, let me take you through Mary's most recent Medicaid run-in. In the past, Medicaid would only pay for tooth extraction, not repair. So, my sister's once beautiful smile is no more. Mary now has less than half her teeth. And due to her TBI, she's not a good candidate for dentures. And in October, her dentist recommended that Mary's distressed tooth receive a root canal and a crown. And Medicaid said no, this is their denial letter. But because of Medicaid expansion, her Blue Cross Healthcare Plus covered all but about $400, thereby allowing Mary to finally keep one of her teeth. There is already little dignity in my sister's situation. Mary is already at the mercy of a governmental bureaucracy. She has been written off as unimportant in the rush to cut spending by any means necessary. The reality is that there are so many Idaho residents like Mary whose lives have devolved into circumstances beyond their control. When that happens, it is the responsibility of those of us who have the means and capacity to show compassion to the state's most vulnerable residents. I echo Gandhi's sentiments when I say how a society treats its most vulnerable is always the measure of its humanity. And just on a side note, I don't believe the Idaho insurance marketplace is very good. My husband is a farmer, and we're a very small business. At the best rate we could get on the marketplace is $1,361.18 per month, with an $8,000 deductible for each one of us. Should both of us need to meet our deductibles by December, we'll have to pay out a minimum of $32,334.16. And so do not listen to the loudest voices scapegoating Medicaid expansion. Please vote no on HB 419.
Thank you. Any questions? Not seeing any. Thank you. Next up is Michael Voloshin in person, and then Annetta Harker virtual. Is Michael Voloshin here? We pull up Annetta Harkin, and then after the Annetta would be Kay Hummel in person and Laura Brown in person. So if we get is she responding or okay. Okay, so then Kay Hummel.
Good morning, Chairman and Committee. I am Kay Hummel. I live in Boise. I have a story for you about my classmate, Andrea. We were in school together from 1st through 12th grade. She died of pneumonia in 2008 at age 53. So they say. But in truth, Andrea died from being poor and not having insurance or Medicaid. She was worn out from the embarrassment of being uninsured and going again and again to the emergency room with illness and bills she could not pay. So she fell sick that winter and she did not get medical attention. And so she died needlessly. One legislator has written to me, please be assured H419 does not repeal any part of Medicaid. Instead, it provides guardrails and accountability for the Department of Health and Welfare. Respectfully, that statement is strange compared to what the bill's language says. What H419 does is set up a series of extra regulations and alleged guardrails that cannot be achieved by a drop-dead date of July 1st, 2025. Some of these regulations were turned down when tried previously. Realistically, it would be impossible to put all of them into effect, all 11 of them, in the required 18 months stipulated by the federal government. So if any one of these unwarranted amendments is not in place by next July of 2025, this bill then effectively repeals Idaho's Medicaid expansion, the exact statute that 61% of the voters approved in 2018. Even more folks support it now. So I have read this proposal many times, and this in fact is what it does. Please do not adopt H419. Turn it down. H419 again will force more of Idaho's underserved people into emergency rooms or into no care at all, like what happened to Andrea. Thank you.
Committee, any questions? Not seeing any. Thank you for your time. Next up is Laura Brown, and then Eleanor Sheeny. Please state your name and who you represent.
Yes, good morning, Chairman, members of the committee. My name is Laura Brown. I'm the Senior Director for Patient and Community Outreach with the Leukemia Lymphoma Society, and I'm a resident in District 19. Our mission at LLS is to improve the lives and quality of life for blood cancer patients and their families. We are here in opposition of House Bill 419. Every day, I help patients find doctors and specialists, figure out how to pay for their medications, and navigate our very complex healthcare system. Many of those patients share how important high-quality health insurance is to manage their disease. Medicaid can be the only option for some to afford their treatment. Otherwise, they will join the growing number of patients who feel trapped by medical debt. Almost 70% of Americans received a medical bill they could not afford, and many will stop or delay treatment because of it. If House Bill 419 were to become law, this will become the reality for thousands of Idahoans. They will have to decide between continuing their treatment or paying for their rent. Providing this patient safety net will not impact the state's financial stability. In fact, over the last several years, this legislature decreased investments in Medicaid. Enrollment in Medicaid has stabilized after the pandemic and post-pandemic unwinding. The financial situation is stable right now, but repealing Medicaid expansion means the state will have to pay an extra $8 million. So protecting Medicaid expansion makes sense not only for patients, but also for the state's budget. We urge you to oppose House Bill 419. Thank you, and I'll stand for any questions.
Thank you. Any questions? Not seeing any. Thank you for your time. Next up is Eleanor Cheehy, and then Julia Davis, and then Jeff Friday. Any of them here?
Jeff Faraday is here.
Jeff Faraday's here. Okay, all right. We'll take what's here.
Mr. Chairman, members of the committee, I'm Jeff Faraday from Boise, and I oppose this measure. The Medicaid expansion law that Idahoans overwhelmingly adopted and enacted in 2018 is making health care available, as you've heard many times today, for thousands. This bill's sponsors have attempted to camouflage this repeal, which is what this bill is, as a group of waiver requests that, if somehow they're not adopted, will cause the automatic repeal of this legislation. I find that absolutely remarkable that the legislature would even consider such a bill. And I was very interested to hear from Mr. Santorino that these waivers are more likely to be approved because they are in a package and because of what he called a condition that's attached to them. What's the condition? The condition is, if you don't approve these, we'll repeal the bill. Then Mr. Birnbaum from the Idaho Freedom Foundation got up and said, the beauty of this bill is that repealer language. This condition of total repeal reminds me of the famous humor magazine on whose cover was a bewildered looking dog with a .45 automatic pointed at its head, and the caption said, "Buy this magazine or we'll shoot this dog." So this bill is an exercise in the legislature, really, I can't believe it, saying, hey, we're concerned about that bathwater. And if it's not fixed by 2025, we're throwing this baby out. This is not the way to make legislation. Please reject this very unusual and, frankly, mean-spirited bill. Thank you.
Thank you. Any questions? Not seeing any. Thank you for your time. I gotta figure out where. Melanie Edwards, virtual. And then it's Beth Norton after that virtual is.
I just stopped it. Okay. Hello?
Hello.
Can you hear me?
We can hear you. We can't see you. I don't know if that's intentional or not. Yeah.
It says the host has stopped the video, just so you know. I've been starting it.
All right.
Yeah, okay, thank you. My name is Melanie Edwards, and I've lived in Eastern Idaho 24 years. I want to explain our family's case. My father, who'd been in the military, died of an illness before I was born, leaving my mother to raise her 3 children on her own. It took her 12 years before she was able to have built her education and qualifications to start a career as a teacher in a community college so that we could all grow with the support of family-sustaining work. And that's when we got our first car, when I was 12. My point is it takes time for a family to get back on their feet after a major setback like an illness or death of the breadwinner in the family. And some families have additional challenges and take longer than others. How can families that are under stress make a go of it without care for their health? I'm a hospital health professional, now retired, and spent all my spare time collecting signatures for Medicaid expansion, like many others testifying today. So I know the harm this bill would do to our most vulnerable. And for what purpose? We see more amputations in the hospital when diabetics go without care. We see more people with strokes when people don't get their blood pressure checked. Healthcare and social costs will be more, quite apart from the healthcare administration costs and losses and errors that have been talked about today. This bill is cruel in its unintended consequences and would cost Idaho taxpayers more. Please oppose this bill. And I just want to add that I saw also a lady with infected, draining wounds all over her body. This was that flesh-eating bug we've often talked about, who was unable to get a medical certificate saying that she was unfit for work. So that's my comment on the definition of able-bodied. Again, please oppose this bill. Thank you.
Any questions for Ms. Edwards? Not seeing any. Thank you for your time. Next up, I have. You're on a different page than I am. Then. Jim Golfrey. I have a T by their name. What's a T?
Oh, that's testimony, right?
Yeah. So I have Beth Norton as the next virtual, and next in person is Kate Jackal. Is Kate Jackal around? And Tracy Olson. Did you get a virtual on the?
Tracy had to go to work, but it looks like Kate Jekyll is up.
Not here.
Oh, I guess
She's not here. No. Okay, and Tracy had to go to work. Okay. Kim Mogg virtual. You have that one? She didn't show up. Okay. Where do you have Tony Lawson?
She said she signed up for it. She might be on another page.
This is, what about Clarice McKinney? Have hers virtual. Where do you have, I don't know who she is, and you can see her back there. She's ready?
I'm ready.
Oh, you have Rhoda Mack. Okay, let's go with that for now.
Okay.
State your name and who
My
you
name is-
represent.
Yes, sir. My name is Rhoda Mack. I live in District 6, and I represent myself. The testimony of healthcare professionals and private citizens here today makes clear that medical expansion has been a resounding success, an essential part of a sensible healthcare system and a popular program. I would like to remind you that more than 70% of Idaho voters oppose this bill to undercut Medicare expansion. This is up from the 61% of people who voted for the original expansion. I suggest that as honest brokers for the will of the people, you will vote against these sugar-coated poison pill cuts to Medicare expansion, which, as we've seen from testimony today, is designed to break Medicare expansion. To date, Idaho has saved money from its participation in the Medicaid Expansion program with savings in the Idaho Department of Correction, Behavioral Health, and Indigent Health Care funds. I suggest that legislators who are fiscal conservatives will oppose this bill. 1/3 of the Medicaid expansion population are Idahoans with serious mental illness. HB 419 will essentially destroy the support networks that these people need. This will compromise the ability of the healthcare system to provide the medical care that will keep troubled people off substance abuse, off the streets, and out of violent situations brought on by psychosis. For the sake of the safety and welfare of the general public, let's not run this bill through. If Idahoans on Medicaid expansion account for 26% of Medicaid accounts, but only 8% of Idaho's Medicaid general fund costs, a fiscal conservative would see that as an obvious savings. Let's not destroy a valuable program. I request that you oppose this bill.
Thank you.
Thank you.
Any questions? Not seeing any. Next one up is Tony Lawson. And then I have Maggie Lyons, virtual. So, Ms. Lawson, if you could stand up, tell us who you represent. Time is yours.
Thank you, Mr. Chairman, members of the committee. My name is Tony Lawson, and I represent the Idaho Hospital Association. Our healthcare system is in a precarious state right now. We have a combination of cost drivers, workforce shortages, providers struggling to stay financially viable and able to meet the needs of a rapidly growing population. We've seen hospitals close services. Most recently, we've seen one of the largest providers in the state announce they're closing their doors, and we're hoping to keep over 400 providers here and find places for 100,000 patients. This bill would provide a tool to destabilize the system even more at the expense of our most vulnerable citizens. I would say instead of adding a bill that could put tens of thousands of people suddenly into the uninsured category. We should be looking at ways to stabilize our healthcare system and build capacity for the coming months and years. I know some are looking to rein in costs in the Medicaid program, but rather than rein in costs, this bill establishes hurdles, removes efficiencies, creates uncertainty. We've seen it today with the questions, and denies Idahoans access to health coverage. I know some are looking for accountability. Rather than accountability, this legislation holds health care coverage for Idahoans hostage unless a list of demands are met by state and federal bureaucrats. This isn't the way to make good policy in Idaho. There are some ideas in this bill that we would probably support. I think most providers would rather have Idahoans enrolled in the health insurance exchange than on Medicaid. So let's work toward that. Don't punish those who need health care because CMS didn't approve a waiver in a time allotted on something that we know they've previously rejected. The budget savings identified here come at the expense of individual Idahoans. If we want to make change to the Medicaid program, I'd ask that you work with Idaho stakeholders to discuss some of the ideas and issues. This legislation is not the answer and simply creates more instability. Thank you.
Any questions for Ms. Lawson? Representative Dixon.
Thank you, Mr. Chairman. Ms. Lawson. So I asked somebody earlier, but how were you involved in the conversation while this was being drafted?
Ms. Lawson.
Mr. Chairman and Representative Dixon, we were not involved in the drafting of this legislation.
Not seeing any other questions. Thank you for
Thank you,
spending
Mr.
time here.
Chairman. Committee.
Next up, we have Maggie Lyons, virtual. She's there? Good. Okay. After that is Sam Sandmeyer in person, and Elizabeth Calvin Williams. Yeah, I think this will be the last one. Is Maggie Lyons, are you there?
Can you hear me?
We can hear you. We can't see you.
It says that my video's been stopped, which is fine, but
Okay.
I'll go ahead and
We can hear
get
you.
started. Okay, great. So, Mr. Chairman, committee members, thank you for the opportunity to be here today. My name is Maggie Lyons. I live in Kootenai County. I live in District 3. I am the executive director for a housing nonprofit here in North Idaho, Panhandle Affordable Housing Alliance. I am also directing a movement in Kootenai County called Charity Reimagined. We work with nonprofits, government agencies, and the faith community to rethink and improve efforts to help people living in poverty as well as our working poor. We currently have 76 service providers in our network, and this work is beginning to really take hold here in North Idaho. We also partner with a national organization called True Charity, a movement focused on rethinking how we help people in need. For decades, hundreds of millions of government dollars have been and continue to be spent fighting the war on poverty, yet 80% of people born into generational poverty never leave it. Unfortunately, most well-intentioned government programs create and sustain dependency. It isn't whether resources are needed, they are. It is how they are deployed. We've heard today how Medicaid has helped many Idahoans. My understanding is these people and Idahoans like them will continue receiving Medicaid coverage under House Bill 419. But the work requirements are needed, and annually confirming eligibility is responsible and necessary. We have learned in our work that work awakens worth. Accountability and exchange foster dignity. In Kootenai County, we are challenging the status quo of handouts, and our service providers are beginning to collaborate and cross-resource in ways that are helping neighbors realize they are not defined by their poverty, that they are worthy and have talents and gifts that they can develop, that they can set goals for a future filled with hope, and receive the support needed to achieve those goals. This is what work does at whatever capacity and level they're able to do it. Policy that supports work requirements for able-bodied adults is not cruel or even uncharitable. In fact, it is just the opposite. It leads people to experience the joy and dignity of earned success. I fully support Representative Redmond's House Bill 419.
Thank you. Committee, any questions? Representative Gallagher.
Thank you, Mr. Chairman. And Ms. Lyons, are you aware of any other organizations nationally like yours, and what has their experience been?
Ms. Lyons.
I am. It's a partner of ours, True Charity, out of Joplin, Missouri. Their experience has been overwhelmingly positive in terms of their approach to helping the poor actually find ways to live free of those shackles. They work closely, mostly with the homeless, honestly, is their primary effort. And that is through a nonprofit called Watered Gardens. True Charity is born out of Watered Gardens as a national organization working across the country, of which 6 members in Idaho belong.
Any other questions? Not seeing any. The next one I have is Sam Sandmeyer, and this will be our last because we are bumping up to our 10:45 deadline in order to get to the floor. So if you could state your name and who you represent, time is yours.
Thank you, Chairman Vander Woude. I represent myself. My name is Sam Sandmeyer. As time is short, I will just say that I agree with the testimony from every person except for the representative from the Freedom Foundation, Ms. Lyons, and the gentleman from Florida who helped present the bill. I had face-to-face conversations with voters in every corner of Idaho, and they overwhelmingly wanted to expand Medicaid to take care of their neighbors and their friends and their family members. Medicaid expansion passed in the vast majority of Idaho districts and counties, both urban and rural. Last night, I emailed all of you charts that clearly illustrate Idahoans' overwhelming support of this program. Idahoans are happy with Medicaid expansion, and I can't believe constituents have to continually come down here and defend threats to this law that Idaho voters passed by a landslide. Voters will not be happy if this essential program is stripped from them by the people they elected. I implore you to vote no on H 419, and I stand for questions.
Thank you. Any questions? Not seeing any. Thank you for your patience and your time, and thank you to all the other people who signed up. We are running out of time, and so we will now ask the representative to come forward and close the discussion.
Thank you, Mr. Chairman and committee members, and I wanted to also thank everyone that was able to testify. I'm very thankful and grateful that we have that opportunity, that people can come testify, and I'm also very thankful that so many people have benefited from Medicaid and been blessed by the system that we have in place. I just wanted to touch on a couple points in closing. The mentally ill conversation came up again. That would be a traditional coverage currently, and they're not part of expansion. And my worry would be, as we keep losing traction with our program, is that they would move to waiting lists. There is said multiple times that this is a repeal bill. And again, I want to honestly tell everyone here that this is not the intent of this legislation. This legislation is putting sideboards in place so that we can continue to have our current program and grow it and help those that most need it. I think today we're at a very pivotal moment with our Medicaid program in Idaho. And I think that this legislation provides safeguards for our seniors. It shields our children, it defends individuals with disabilities, and it unequivocally protects them. But let's not overlook other beneficiaries with this legislation. That's the taxpayers of Idaho. They're the backbone of this program, and we're also protecting their interests. This legislation sends a clear message to able-bodied, primarily those 18 to 40, that the taxpayers in the state are willing to extend a helping hand, but we want a reciprocal effort to engage in part-time, volunteer with your community, or pursue education. Let's meet halfway, and let's make sure that we can continue to have this safety net in place. This also redefines the relationship between Washington, D.C., the federal government, and asserts that Idaho wants to run this program our way, the Idaho way. We insist on working on our terms and not the federal government's terms. We're making a stand against inefficiencies and deceit, fraud, waste, abuse in our system. We refuse to turn a blind eye here or in D.C. and demand the integrity in the program with respect to hard-earned contribution of the Idaho's taxpayers be free from fraud. To those committed to preserving Medicaid for the truly needy and to champion the expansion and safeguard of the taxpayer interest, your support for this legislation is crucial. Let's demonstrate to Washington the right way to do this. I want to thank all the committee members, everyone that testified, Chairman, for having this hearing. I think it's a great discussion to have, and I really do appreciate all the commentary here. So thank you very much. I'll take a seat.
All right. Committee, House Bill 419 is before the committee. Representative Kingsley.
Mr. Chairman, for a motion,
Motion's always in order.
I'd like to make a motion that we send House Bill 419 to the floor with a due pass recommendation.
We do have a motion to send House Bill 419 to the floor with the due pass recommendation. Any discussion? Representative Rubel.
Thank you, Mr. Chairman, for a substitute motion.
Substitute motion is always in order sometimes.
I've learned that from you in the past, Mr. Chairman. I move that we hold House Bill 419 in committee. And if I might speak to that motion.
You sure may.
Thank you. I very much take my good friend, Representative Redmond, at his word. I don't believe he would be trying to repeal Medicaid expansion and tell us otherwise. But I do believe very strongly that the upshot of this would be to repeal Medicaid expansion. I see no practical scenario in which this slate of exceptions or waivers gets approved. They've already actually been explicitly denied. 2 of them have been explicitly denied. There is no state in the country that has any waiver like this approved. I don't think the feds really care that much about whether Idaho repeals Medicaid expansion such that they would grant such waivers for fear of setting this kind of precedent for other states. So it seems extremely impractical. And frankly, even if they were granted, I have serious concerns about the fallout of kicking hundreds of thousands. That we would still have to kick hundreds of thousands off of Medicaid to hit the cap. So I think it would ultimately wreak untold grief upon the people of Idaho. And I think, yes, it's a conditional repeal, but ultimately the condition is like saying, unless you can produce a unicorn that dances the tango, you will be repealing Medicaid expansion. So effectively repealing Medicaid expansion with this bill. So with that, and in light of all the testimony we've heard today, I hope that you will support the substitute motion.
Representative Gallagher.
Thank you, Mr. Chairman. For an amended substitute motion?
That'd be the next step.
I'd like to amend the substitute motion to send RS 31158 in place of H 419 to the second reading calendar with no recommendation for the committee, and to speak on that motion.
You may speak on that motion.
This is obviously a very big issue, and I think that we should include the body of the House in this conversation. And so I believe that sending this to the floor would give more voice to the body, and I believe that we should send it to the floor for more discussion.
Okay. Representative Healy.
Thank you, Mr. Chairman. I was thinking about Representative Gallagher's thoughts there. I do like that. Originally, I was going to speak to Representative Rebel's motion. I do believe this warrants a lot more consideration before we vote on it, period. So I don't know if I need to make an amendment to Representative Gallagher.
No, you can't. We have 3 motions. You're too late.
So we just have to vote on hers?
Yeah.
Because I do think it warrants more consideration. I am not ready to vote on this. So
Okay.
I don't think it's ready.
So yes, Representative Blanksma.
Yeah, for a comment. I would say this as there were 2 of us that were primary negotiators on the original Medicaid sideboard bill. It was, save one other bill that I've negotiated in the 8 years that I've been here, and I'm not even going to tell you what it was. It was the most painful bill that we have ever negotiated. So I have some concerns, and I don't, maybe the good chairman has negotiated
I
something.
was the other one who was negotiating.
Yeah, and so it took a long time to get to where we were, and I have some serious questions because this was, I feel as if we spent a lot of time working on it, and I want my questions answered as to the negotiations that we had on the state exchange that we wanted a waiver for, and on the work requirement. And I want to know if we're getting slow rolled by our Department of Health and Welfare, or if it's a federal problem, because I want answers to those questions before I'm willing to move this bill. And then I also want to know, I think that there's also an elephant in the room that we had to deal with, and that's the CAT fund, because we got rid of the CAT fund and we now have an indigent issue. So until I get those questions answered, because of all the time that it took us to negotiate those, I'm uncomfortable moving it forward.
And it took me 4 years to get rid of the cap fund. Okay, committee, any further discussion? Seeing none, we do have a substitute motion. Amended substitute motion. I'm going to ask the secretary to take a roll call because my ears aren't good enough to distinguish between that. And so clarification on the motion is to send RS 31158 to the floor without recommendation, if I remember. To the second reading. Well, suggested that the speaker put it on the second reading. So with that, if you'll do the roll call vote.
Vice Chairman Erickson,
No.
Representative Blanksma,
No.
Representative Kingsley, Representative Mitchell,
Yes.
Representative Dixon, Representative Gallagher,
Yes.
Representative Healy, Representative Redmond,
Yes.
Representative Wheeler,
No.
Representative Wilson, Representative Rubel, Representative Roberts,
No.
Chairman Vandewoude,
Yes. Roll call is 5 in favor, 8 against. Motion has failed. Next up is the substitute motion. And that motion, I believe, if I remember correctly, is to hold 419 in committee.
A little slow on the draw, aren't you, Van?
So another roll call.
Vice Chairman Erickson,
Yes.
Representative Blanksma,
Yes.
Representative Kingsley, Representative Mitchell,
No.
Representative Dixon,
Yes.
Representative Gallagher,
No.
Representative Healy, Representative Redmond, Representative Wheeler,
Yes.
Representative Wilson, Representative Rubel,
Yes.
Representative Roberts,
Yes.
Chairman Vandewoude,
No. The roll call shows 8 in favor, 5 against. Motion has passed. House Bill 419 will be held in committee. So with that, committee, members of the audience, and all the people who have participated, thank you for your time and your patience. We will not be meeting tomorrow.